Glenn, great to be with you here at Health in Vegas this year.
It's great to be with you as well.
A couple cool things we want to dive into. First being your foundational health partners. Tell us more about that and what that means for healthcare.
Well, so last week we announced something really important in healthcare, and that is the first group of national independent provider ecosystem group. And that was really 10 different foundational partners, really followed by an 11th who came first, and that was Rush Health System in Chicago. And they were kind of our pilot, and then we expanded it across the country. And these are 10 of the most innovative, highest quality health systems across the country. And what they agreed to do is work closely with us to provide more of a direct link to large and mid-sized self-insured employers. So in the past, most of these health systems, while dominant in their respective areas, couldn't work nationally with some of the largest companies across the country, and because they needed national networks. Now they can be a part of a national network. And what does that mean to all of us as health consumers? It means getting preferred access into those places which are high quality. It means getting very aggressive pricing. Not the lowest pricing necessarily, because these are high quality places, but high quality, very cost effective pricing. And it means eliminate all of the billing issues and all of the challenges that you normally have in healthcare. So creating a better experience. From their perspective, what we've agreed to do is pay them on the day that the surgery or procedure is done. And that's a commonplace in the rest of our lives, but unheard of in healthcare. And that really makes a difference to them. And it's a real partnership, a real collaboration. You know, it's interesting. People say, where did that idea come from? And I always smile. It's the way the rest of our world works. You know, when you go to Starbucks and you don't say, maybe I'll pay you in a few months for this latte I received. When your plumber comes, you pay him or her. But in healthcare, we seem to have this idea that we don't have to pay maybe ever, maybe immediately. And we've changed that paradigm in a very big way.
So along with that, you've been very busy. You also have, which I want to make sure we talk about, the Vufi partnership. Can you talk about what that means as well?
Well, Vufi was really amazing. It fits with exactly what we talk about, and that is healthcare is an information business at its heart. And so when something goes wrong as a health consumer, what do? First, we try to figure out what should we do. We need better information. And then sometimes we jump into a procedure, or we get even a digital health app. And what we really have to start with is the right information. And so Vufi was really a concept that came about from Andy Roddick, you know, who everyone knows who Andy is, but as one of the world's best tennis players, he received a level of care that at the end of the day, he thought, why doesn't everybody receive this care? And that care always started with a basic orthopedic evaluation, right? An orthopedic consult. And so he said, that's how everyone should start. How do we deliver that to everyone? Well, we invent some really innovative digital tools. We put those at the front of the process. And it hurts me as a digital person, hurts me to say this, but even before you get a digital point application, you should know what your issues are. And that's what Vufi does, but it delivers concierge approach and world-class care to everybody. And that's what excited us about the partnership. And Andy's view was everybody should have the same care I received. And I really like that. That's kind of an ethos at Transcarent, which is we think everyone should have one place to go for all their care, and we think everyone should have an easy route to get high quality, affordable health and care.
When we first heard about that, I really wanted to see you return Andy's serve while being peppered with questions. That was a weird request. We couldn't do it. It's fine. I said to Andy, I will take him on any time, just not in tennis, not in anything really.
I love it. But no, his commitment to this is really important. You know, this isn't, in today's world, we see so many celebrity endorsements. This is far from it. He is working the business. He's engaged in the business, and he's been, the first user of the business. So from that perspective, it's a great partnership for us.
That's huge. Well, congratulations on that.
Thank you.
Last thing I really want to dig into, we've been asking everyone this at Health this year, what the future of healthcare looks like through your lens and Transcarent's role in that future.
Well, I think the future of healthcare, it's an easy question for us, and that is the future of healthcare is consumer-driven healthcare. And you mentioned this earlier, the first thing you need in consumer-driven healthcare is better information, and then you need, and that keeps you healthy. And then when you need care, you need high quality care, and it needs to be delivered affordably. So that's our role at Transcarent, which is we put in everybody's hand essentially the key to their health future. And that is one place to go for care. You look at your phone, looks back on you, it signs you in, and you can do 5 things really simply. Number 1, care in 60 seconds. Nowhere else can you get access to a physician, a real live physician, in 60 seconds. To answer any question you have. Second, a pharmaceutical marketplace, and that includes GoodRx, it includes Mark Cuban. It's again one place to go to type in, here's my medication, here's where I can get it, here's the lowest cost to get it. Number 3, care at home or close to it. So a lot of the care that people go to the hospital for today can be delivered at their home, okay? And a lot of people say, well, that's for wealthy people. No, we can send a private caregiver to your home to deliver infusion therapy or many other things more cost effectively than having you go to the hospital. So that's number 3. Number 4, surgery care. We talked about high quality surgeries of all kinds, not just orthopedic. And last but not least, complex care like cancer. 25% of all the diagnoses in cancer are not either accurate or the most effective treatment or the most cost-effective treatment. And when you put those together, that means a lot of people aren't getting the right care. So that is all available in one place. That's what Transcarent's about. And we think our role is to not just deliver this, but to spur the whole health care ecosystem to change and to be more consumer focused. And I guarantee you have a number of apps on your phone and you use them. Why? You want to be in charge. You want to decide from Spotify what you do. You want to book your own travel. You want to order your own, Lyft or Uber. And that puts you in charge. And you can make lots of decisions that were only a dream years ago. We want healthcare to be just like that. You're in charge. You have the right information. You can make the best decision for you and for your family. Really, really important. And you can afford it. And that's the other piece of it.
Well, Glenn, thank you so much for joining us here at Health, and we're wishing you and the Transcarent team the best of luck and look forward to staying in touch.
Thank you. Thanks for getting the message out for us.